Welcome to CSP 383 Textbook Lectures, Chapter 2, Definition and Classification of Mental Retardation. So we start with that word, mental retardation. That is the name of your textbook. That's not what we're going to use. The federal definition now uses intellectual disability. When we talk about adults, we tend to use the word developmental disability. You can also hear the word cognitive impairment. In Mississippi, we use educational disability and significant cognitive disability. So you just got to keep in mind those are all talking about the self-same thing. Here's Colton again, chilling out in the pool. And so our question is, when a person has a developmental disability, are they all the same? Are two people with cognitive disabilities the same? Or are they different? And how are they different or the same from you? Naming and defining and classifying. This chapter in your book is very weak, and in places it's outdated. It spends way too much time on how the definition evolved. For purposes of the test, use this PowerPoint. Naming, classifying, and defining. When we are using a term, we want one that helps us differentiate between people who have the disability and those who don't, and between people who have similar disabilities. So does it explain what it is and what it's not? Does it allow generalizations about the group? Is it consistent with some theoretical framework? Here are some terms that have been used for people in this category: feeble-minded, retarded, afflicted, developmental disability, intellectual challenged. Which ones meet the criteria that we had on the previous slide? Here are the three we use most: developmental disability, intellectual disability, and cognitive impairment. The American Association on Intellectual and Developmental Disabilities have one definition. The ARC has a different definition. The Council for Exceptional Children has yet another definition. But what we want to look at is the federal definition. The federal definition, and you can see it right here, says significantly sub-average general intellectual functioning existing concurrently with deficits in adaptive behavior and manifested during the developmental period that adversely affects a child's educational performance. So here's what we have. Idea: significantly sub-average general intellectual functioning existing concurrently with deficits in adaptive behavior manifested during the developmental period that adversely affects the child's performance.
AAIDD says that an intellectual disability is characterized by significant limitations both in intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. The disability originates before the age of 18. To understand the definition, let's take a few minutes to break it down. First, significant limitations in intellectual functioning. That simply means intelligence or general mental capacity for things like problem solving, the ability to reason and understand. One criterion to measure intellectual functioning is an IQ test. This is the most commonly accepted way to measure intellectual functioning. Generally, an IQ test score of around 70 to 75 indicates a limitation in this area. Next is significant limitations in adaptive behavior. Adaptive behavior includes conceptual, social, and practical skills that have been learned in order to function in everyday life situations. Examples of conceptual skills include reading and writing, money concepts, and the ability to understand written or spoken language. Social skills are things like following rules and obeying laws, how you interact with other people, and your own sense of self-esteem. Practical skills include day-to-day activities such as routines, housekeeping, and safety. To measure adaptive behavior, professionals look at what a person can do in comparison to others in the same age group. The last part of the definition is originates before the age of 18. This simply means that for someone to have an intellectual disability, Whatever happened to change the typical course of development had to happen before the age of 18.
So as the video says, we're looking at IQ below 70. We're looking at sub-average functioning, not isolated deficits. So the person has to be below average in every area they measure. And then adaptive behavior, and that has to do with things like reading, money, language, social skills, practical skills, taking care of yourself. And then manifested during the developmental period. And the last part of it is it has to affect educational performance, or it's not relevant to special education. So early classifications, we had words like idiots and imbeciles and feeble-minded and moron. Those were actually medical terms. We talked about congenital idiocy, which was conditions at birth. Developmental idiocy was due to anxiety, and accidental idiocy was due to injury or illness. Now when we look at causes, at classifications, one of the ways we look is by etiology or cause. So chromosomal, and that has to do with when your chromosomes unite, and we'll talk about that in chapter 4. Syndromes like Down syndrome, Edwards syndrome, Williams syndrome, which is a set of characteristics that when you see all those characteristics together have a commonality. Metabolic, that's how your body processes food. Developmental disorders of brain formation, that would be like anencephaly, where the person has a brain stem but they don't have the rest of the brain. It also would include things like microcephaly, very small head, or macrocephaly, very large head. Environmental influences, intrauterine, so things that happen during the pregnancy, and neonatal, things that happen in the first few months of life. And then we have postnatal causes, head injuries, infectious, demyelinating disorders. That's where the myelin, which is the sheath on your muscles, begin to deteriorate. Degenerative diseases, where any part of your body begins to deteriorate, including your brain. Seizure disorders. Toxic metabolic disorders, where you have, for instance, you ingest lead and the lead is not metabolized by your body and builds up in your brain. Malnutrition, environmental deprivation. Hypoconnection syndrome has to do with how your nerve endings are connected. Then we have IQ's classification. So if you look at IQ, if your IQ is average, this says between 91 and 110. It's actually usually considered to be between 85 and 115. And you go below that and you see 80 to 90 being low, dull, normal, 66 to 79 according to this would be borderline, and 65 and below is defective. Actually, the numbers we use now would be 70 here. And so then classification, we look at mild being between 50 and 70 IQ. In the old days, we called that educable because the understanding was that people in that age could learn to read and write and do very simple math. And then 35 to 45 was considered to be trainable because people in that range could be trained to do unskilled jobs. And then 20 to 34 was severe, and below 20 was profound. We usually combine severe and profound now because you really cannot get an IQ score below 20. It just means the person is functioning so low that they don't even respond. In 1992, they suggested that rather than IQ levels, we should use needed supports, intermittent, limited, intensive, or pervasive. Prevalence, about 7 to 8 million Americans have an intellectual disability. 311 million people in the U.S., so that's about 0.08%. Children with intellectual disabilities represent about 0.9% of school-age population. But if we look at IQ, just the way IQ is set up, it should be about 2 to 3% of the population. And the reason for that, several reasons. One is that people with cognitive disabilities tend to have a shorter lifespan. people with mild disabilities aren't identified until they start school. And because mild disabilities are considered hidden disabilities, then once the person finishes school, people don't think of them as having an intellectual disability anymore. And that is that chapter.